Unfortunately, we still have a long way to go in terms of making sure that children who face life-limiting and life-threatening illnesses and conditions, as well as their families, have access to the care that they need. Although we've had some improvements, there are still a lot of gaps and issues that remain. There are too many children in Canada who face life-limiting and life-threatening illnesses who are not receiving the quality of care that they need when they need it. Palliative care is a priority for Cardus Health. We've done work on it in the past, and that's going to continue in the next coming years. We have forthcoming research looking at the need for ensuring a high quality of palliative care writ large. And we continue to advocate for access to palliative care, quality of data, and appropriate funding as well. One place to start would be addressing the need for better data and research on this issue. Palliative care in general, there are gaps in the data, and in pediatric palliative care, that's even more severe. So for the federal government to do good policy, it needs to have good data, so that would be a good place to start. We don't want our children to be sick. We don't want our children to be in danger of dying. So this is not something that we want to think about, but the reality is that there are children who will be born or injured or develop a condition or illness that is life-limiting and life-threatening. And having that care for that patient and for their whole family that takes care of not only their physical symptoms, but their whole being, their emotional needs, their social needs, their spiritual needs, that can make a huge difference for those patients and those families as they go through their illness and potentially as well in bereavement. Any time that children don't have access to that care in these really difficult illnesses and conditions, it's already too late. So we have a long way to go to catch up to where we need to be. But in terms of timeliness, we also need to consider the fact that they have been discussing in Parliament the possibility of expanding euthanasia-assisted suicide or medical assistance in dying or MAID to children. So if we are going to even consider that conversation, we need to make sure that there is adequate care being provided to children who are facing these kinds of conditions first.